Various school districts are coming up with reopening plans in the fall, which presents a lot of challenges when it comes to keeping teachers and students safe. KAMR Local 4's Jason Britch has more from an area medical professional on how COVID-19 applies to kids and how you can help them prevent the spread of it.
We have no idea how long this pandemic will last, so at some point we have to figure out strategies in which we can go back to school and help keep kids safe.
With schools anticipating reopening soon, Dr. Evelyn Sabar with the Texas Tech University Health Sciences Center spoke with us about how COVID-19 applies to kids, such as the spread of it.
Kids don't get infected as easily as someone who is older might be. Part of that has to do with what part of the body the virus likes to infect and certain places that it likes to grab on. That's not as well developed in the pediatric population as it is in an adult population.
Dr. Sabar says one of the bigger differentiates between how it applies to children and adults is that children are more likely to be symptomatic.
We see about an 80% symptomatic group.
Which means parents need to be more wary on how they approach it.
The new thought process needs to be, if you think your child is sick, you need to keep them home until we can figure out what it is.
Social distancing could also present challenges since children under 10 are not required to wear masks.
It's even more challenging, I think, the younger the kids are. Kids are not very good about wearing their mask. Young kids tend to just play with their mask.
Dr. Sabar's biggest piece of advice to school administrators?
Make sure that people have masks and that they have good hand hygiene and they're constantly enforcing that.
In Amarillo, Jason Britch, KAMR Local 4 News.
Dr. Sabar also says that school administrators need to have grace with both kids and teachers and have options available because of anticipated prolonged absences due to the virus.